What would youth care look like if self-worth was not assumed but intentionally taught? If belief, identity, and internal capacity were treated as core components of care, alongside therapy, structure, and skill building? To answer that, it helps to clarify what teaching self-worth actually means in a residential environment. Self-worth education is not affirmations or positivity. It is not lowering expectations or removing accountability. And it is not a replacement for clinical treatment. Self-worth education is a structured way of helping young people understand how they see themselves, how that self-view shapes decisions, and how belief influences behavior over time. In many residential settings, interventions focus appropriately on behavior, symptoms, and skills. Youth learn coping strategies. They practice regulation. They engage in groups designed to reduce risk and increase stability. These components are essential. But belief and identity are often left implicit. When they are not addressed directly, youth may comply with treatment while still holding beliefs such as, "I always mess this up," or "this won't matter once I leave." A residential environment that teaches self-worth looks different at the foundation. Belief is made visible rather than assumed. Youth are given language to understand how thoughts, beliefs, and self-perception influence choices. They explore identity, values, and strengths in ways that are structured, predictable, and developmentally appropriate. This aligns directly with positive youth development, which emphasizes building internal assets such as identity, agency, and purpose, not only reducing negative behavior. In practice, this means groups are not only about rule following or symptom management. They include intentional opportunities for youth to reflect on who they are, what matters to them, and how they want to show up in the world. Youth learn to make decisions through a values-based lens. They learn that mistakes are part of growth, not proof of failure. They begin to see themselves as capable participants in their own development. This approach does not remove structure. It makes structure more effective. Predictable routines, clear expectations, and consistent facilitation create psychological safety, which research consistently shows is necessary for learning and behavior change. Importantly, teaching self-worth complements existing interventions. Therapy builds coping and insight. Behavioral programming provides accountability. Educational and vocational services build competence. Self-worth education strengthens all of these by addressing the belief system that determines whether youth use what they learn. In environments where self-worth is intentionally taught, staff often see meaningful shifts. Youth engage more authentically rather than perform compliance. They recover from setbacks more quickly. They begin making decisions with long-term goals in mind. This is what holistic care looks like in practice. Not a new philosophy layered on top of youth mental and behavioral health care, but a missing component integrated into it. This vision is what informs the Self-Worth Cultivation Program. It was designed to make self-worth education structured, teachable, and realistic within residential environments. Because when belief is addressed alongside skills, care supports not just stabilization, but lasting growth.